Good afternoon. This is Peter Thomas from Washington, D.C., General Counsel to the NAAOP. Wanted to inform you of some great developments with respect to private insurance and the separation between durable medical equipment and orthotics and prosthetics. For several years, the NAAOP, working in conjunction with the Alliance, has put forward a strong advocacy position to have a separate definition of orthotics and prosthetics listed in what they call the Uniform Benefits and Coverage, in particular the Uniform Glossary of terms that typically are used by consumers and health plans under the Affordable Care Act. This is a document that individuals need to read and understand in order to know what they're purchasing in their ACA private insurance plans. So this is not a Medicare issue or Medicaid, but it certainly may impact Medicare and Medicaid down the line. There was extensive advocacy over the last 6 years to try to make sure that O&P was defined separately from durable medical equipment and did not come under that definition and was not exposed to any of the caps in coverage or monetary caps that often apply to durable medical equipment. For 5 years, it was clear that the regulations were not going to be changed to accommodate this separation, despite the fact that we had gotten included in the Affordable Care Act itself some very positive language on rehabilitative and habilitative services and devices. In fact, George Miller, the chairman of the Education and Labor Committee in the House, upon passage of the ACA on the House floor, stated in his floor statement that it is my expectation that prosthetics, orthotics, and related supplies will be defined separately from durable medical equipment. So that was good language from a legislative history perspective. But the fact is that the regulations had not been issued to accomplish that goal. I'm happy to say that just a couple of days ago, the HHS regulations came out. And in fact, the Uniform Glossary of Medical Terms now defines orthotics and prosthetics separately from durable medical equipment. The definition reads as follows: leg, arm, back, and neck braces and artificial legs, arms, and eyes. These services include adjustments, repairs, replacements required because of breakage, wear, loss, or a change in the patient's physical condition. Now, comments are due to this definition by the end of March, and we'll certainly be submitting comments. And they, in fact, seek some alterations to the definition itself. It needs to be a definition that reads at a 5th to 7th grade level so that people across the country can really understand what the benefit means. But the bottom line is this: in our search to try to separate DME from O&P, this is a major milestone. And this is something that we're very proud to announce today, that the ACA health plans will now define O&P separately from DME. This doesn't mean that every ACA health plan will cover whatever prosthetics and orthotics you wish. It does mean that people will have a better understanding for what O&P care is and the fact that it is not exposed to DME caps or other kinds of mechanisms that restrict access to durable medical equipment. It makes it much more clear that there's a separation between DME and O&P, and that's been a long-standing goal of NAAOP and the O&P Alliance. Thanks so much.